Hello, Perry Posse. Welcome to another episode. So, this is Tara Harrison, licensed professional counselor, and today I have with me Dr. Gail Jackson, and she is the author of this wonderful book, Absolutely Fabulous, which provides secrets to feeling fabulous after 40, navigating perimenopause, there it is, menopause and beyond. So, I read this book and I loved it,
Oh,
and I can't wait to talk to you about it today.
great. And it's an Amazon bestseller.
Is it really? Oh, that's
Yes, yes,
fantastic.
yes, yes.
Well, a lot of us really want to feel absolutely fabulous because we feel like wet cardboard. So,
Hmm.
feeling absolutely fabulous sounds fantastic to me. Well, so what inspired you to write this book?
I think when I was in my medical practice, I had patients and friends who were older than than I was and am, who were miserable. And during that time, there was nothing in the Western literature available for them that was safe and healthy and effective, and that was not fraught with complications and serious long-term complications and consequences, including cancer. No one was talking about it. The grand rounds were never about anything about menopause, and it was never the conversation. I was a single voice.
Wow.
So I realized it was nothing there, and I had friends who were miserable. And so then I changed I'm always been curious. So I started researching into regenerative functional medicine. And oh my God, it was a plethora of options available. So then we focused our practice and added functional regenerative medicine to our full OBGYN practice to offer patients a safe, effective option to help balance them through this often turbulent time of their lives, or at least irritative time of their lives.
All of those and above, yes.
Mm-hmm.
So, what's functional regenerative medicine?
So there's a world of medicine that's not called integrative medicine. We are Western medicine. It's another term for it. I can't remember right what it is, but we're Western medicine, and everything is related to uh, um, uh, um, research and testing and FDA approval and options that are usually made by chemical labs. And the options that were available during that time were fraught with complications. So, functional medicine, regenerative medicine looks at other options. And there are pharmacists who are experts in compounding medications because something may not be available for you. For instance, if someone had asthma and they were just allergic to maybe one of the ingredients of whatever's available on the market, there are pharmacies available to make you something that will give you good results and that without the additives. So compounding, regenerative medicine uses a gamut of compounding pharmacies which are regulated and accredited. So it's not just somebody opening up something, trying to just mix up something and offer it for safer options because many of them are plant-based.
And so, is this where the bioidentical hormone replacement therapy originated?
It is, and now it's mainstream. So fortunately, my lonely voice has now been replaced by a cacophony of voices. Every day, all day, everybody's
Yes.
talking about perimenopause and some options available. Every day, all day, through all the social media outlets.
Yes, it's wonderful to see so many options. And especially for me, I'm 46, so I'm right in the thick of it. And I'm
Mm-hmm.
really grateful that I can go to my gynecologist and get bioidentical hormone replacement. I don't have to go out of state or, I mean, it's not like so hard to find like it was 10 years ago. I remember when my mom went through this, she was really lucky. She researched and found someone in the Dallas area, but it was like this one person that she could go to. And she used the Wiley protocol is what it was
Mm-hmm.
called. I don't know if you're familiar with it. I don't even really know what it means, but it's what she used back then, 20 years ago or whatever. And, um, 25 years, anyway, whatever. And we have so many more options now.
Mm-hmm.
So So perimenopause, let's talk about how someone can know that that's happening to them. And especially if you're not able to track periods, like hysterectomy, ablation. And so a lot of times it's like, oh, your period starts to become irregular. This happens to your periods. But what if you can't track it that way? Like, how do you know? What are some
Mhm.
signs?
Yeah, that's a great question, Tara, because it's all about definition. Okay, menopause by definition is that one day when you've gone 1 year without a menstrual cycle. But when we talk about menopause, we're talking about the symptoms associated with that, with the cessation of your menses. Same thing, perimenopause, we're not really talking about tracking the periods. We're talking about the symptoms that are associated with that time in your life where sometimes you're making adequate hormones and sometimes you're not. And so we're balancing you through those change, and then some of the endocrine organs are just not making enough hormones to satisfy you. So it doesn't have to be you don't it does not have to be defined by your menstrual cycle. So if you do not have a uterus, or you've had an ablation, then you're experiencing the symptoms. Then it's perimenopause. So it's really defined by the symptoms versus the presence or absence of bleeding or irregular bleeding or skip cycles.
What symptoms do people look for? I mean, we know the ones that are classic, hot flashes, insomnia, things like that. But I've learned through my journey that there's so many like hundreds of really fun symptoms that we get to deal with. Like, well, for me, once a month, I feel like I have a stomach virus. Right. In fact, right now I'm nauseous, and it's like 3 days or 4 days, and it happens every month. And I'm like, I'm not really sure what this is because I don't have periods anymore, so I'm not sure where I am in my cycle. What's happening? So that's one, but that's just one that I'm going through. But what are some things that you hear from women that come to you, or things you can just demystify a little bit for us?
The symptoms associated with perimenopause are the symptoms associated with testosterone deficiency. Testosterone begins to decrease, and the production of it is significantly less prior to the estrogen. So, some of the symptoms that are related to low testosterone, and many of them you thought you were told you just had to live with. You need to rest a little more. You need to do a little more self care. You need to do a little more, work out a little more. But here's something we hear all the time, and the main one is the main one that women come to us is the inability to sleep or inability to sleep through the night. But it can be just as simple as inability to lose the weight. So irritability, mood swings, low libido, weight gain. Weight gain, I mean by you work out the same, you eat the same, but you can't shed those 5 pounds. So when women are often dismissed when they say, I need to lose this weight when they're, considered small by our standards, but they know their body is basically a little collection, that muffin top that just won't move. And it's
Mm.
related to hormone imbalance. So irritability, mood swings, low libido, weight gain, fatigue, difficulty sleeping, brain fog, memory, irritability and anxiety, and also loss of body contour, decrease in muscle mass, mushy muscles, and so those are some of the symptoms. So they're usually vague, and people are told you need to rest more, relax more. And I think the women quote and say, finally the kids are sleeping, now I can't sleep. So
Right.
I think what's important is you don't need to dismiss any one symptom thinking that it's just this, so I'm not ready to get some help, because a lot of women come in, number one, for the weight gain or difficulty losing weight. Uh, Number two is difficult inability to sleep through the night, and the brain fog. So sometimes it's just one, and they're usually related to low testosterone. Now, when the estrogen becomes depleted, they knock out the way down, because that's the hot flashes, night sweats, dry skin, dry vagina, but the hot flashes can be debilitating. So that's the obvious sign, and that's associated with estrogen deficiency. And there's not a lot of information, even in the Western literature, about testosterone. The way I found out about it, I was trying all these different options to treat or help manage my friends with menopause. And for a minute, there was a pill, an estrogen pill that had a touch of testosterone, because my only option before that was just to continually increase the estrogen exponentially and try to help the hot flashes. But women otherwise were miserable, couldn't sleep, and the other symptoms that are associated with, we now know, low testosterone. So when this
Hmm.
estrogen tab or estrogen test, I think it was called, came out, only for a fleeting moment, I gave it to my patients, and oh my God, what a change. I mean, it was a noticeable change. It was just a touch of testosterone. And I'm like, oh my, there is something to
Hmm.
this testosterone. And we have to demystify the notion that testosterone is a male's hormone, because women need a tenth of it. A tenth of it is life changing. So the symptoms associated with low testosterone are usually those that women experience in their 40s and sometimes late 30s. But those, and it's not too early to start it as long as you've finished having children. You can certainly start your testosterone balancing.
So what should people expect if they start using testosterone, and how is that prescribed? Like, what, I know there's creams and pellets, and maybe you could talk more about that, all the different ways that someone could um, have testosterone in their body.
Well, I remember my first weekend after getting balanced. Oh my God, I had amazing energy. I think one of my patients shared it with me, and she said it's almost like your world was black and white, and now it's in brilliant technicolor because it's a lift that you cannot even quantify. And I still remember I was delivering babies. I think I did 4 deliveries. I went to 3 parties. You
Oh
know,
my gosh.
I was horny as I can be. I had a lot of sex, and I just remember feeling so alive. And I think that's what a lot of women share with us is like, oh my God, I'm alive again. I feel vital again. So I think that's
Wow.
what. So that's the effect we see when we balance testosterone. So women go to their doctor and they do a hormone panel. They usually do not test for testosterone because Western medicine doesn't know much about it. And they check your thyroid and they say, well, your TSH is fine. I've got good news for you. You're fine, but you're not fine. You're miserable. So it's just being able to find a practitioner who specializes in this. And I've never denounced anyone who doesn't. This was just my choice for my patients, and selfishly for me when it was my turn. Fortunately,
Yeah.
fortunately for my patients, my menopause is miserable. When my testosterone drops, it's like not pretty. I actually can open my drawer right now, and I have a little needle right here that I can go and draw a little testosterone and give it to myself as we precede our pelletins visits with we call this a T-shot. And women are coming, I need a T-shot because it starts working within 30 minutes. It lasts for 2 weeks while you're waiting for your pellets to kick in. But fortunately for my patients, my menopause was miserable. And when my testosterone is low, it's very evident to me. And I make sure I balance it so it's not evident to those around me.
How do you know? What's your internal compass around when it's low?
You know what? I feel sad. I feel depressed, and everything is fine. Like I said, there's no reason for me to feel this sad. I want to cry. I maybe want to go and listen to a sermon. I may feel like I want to go to church, but I just feel like I need something to lift me up. And then I look at my world like there's nothing physically or that I can point to now that's causing the sadness. I should be feeling amazing. So then I have it everywhere. I have some at home. I have a little vial of testosterone for me at home. I grab my syringe, give myself this, and I inject this in my thigh. And like in 20 minutes, I'm like back.
Wow.
So I get my pellets. Pellets typically we schedule every 4 months. I burn through mine. So I get mine every 2.5 months. You don't have to wait to the 4 months. We listen to your body and what your body needs. And so in between mine, especially toward the end when it's time to get a reboost, I feel the symptoms of testosterone drop. The deficit of testosterone.
Wow, I didn't realize it made that much of a difference. That's really amazing.
Well, fortunately for my patients, it does in me. So we have people who come. Some people come once and we never see them again, or maybe 3, 4 years ago, like, oh, I need to get back in there. And we have patients, one patient who comes every 2 months. And I have a woman who's 80 who looks about 65 that comes every 3 months. So really, it's depends on what your body's needs are. And I said, fortunately for my patients, mine's miserable, so I get it.
So with testosterone, then, so you said you have a patient who's 80 with testosterone, then there's not a time that you have to stop taking it?
Not at all.
Oh, okay. That's interesting.
And it helps a lot with that memory. And if you have a family history of dementia and Alzheimer's, it's really a preventive way of thought for an excellent way of preventive medicine because at least you're doing something. And I have many patients that call and say, I need to come in. I can tell because I have brain fog. So majority of our patients, there's usually one thing. I couldn't sleep last night, or my brain fog, or I looked at my husband like, I wish you weren't here. Like, okay, I got to go get balanced. So,
Yeah, a lot of people do report that, and I'm in a lot of the groups, and women are just like, I just can't stand my husband. Everything he does is so annoying, and so
yeah,
that's low testosterone, or
that's
maybe he really is annoying. I mean, not saying I don't want to invalidate anyone's feelings, but
yeah. I think you things bounce off of you a little more when your testosterone is balanced. I love it when Michelle Obama said, because everyone thought their marriage was so perfect. She looks at Barack and like, you chew so loud, So yeah. So I got to tell the patients, I said, okay, I get you balance. That's the best I can do. The rest is on you.
yeah, that's true. You might need additional help. Well,
Right.
so you talked about estrogen and testosterone, and how does progesterone fall into this for you?
Progesterone is important when you're trying to get pregnant or PMS to treat that to kind of settle down the menstrual cycles. Progesterone in the the menopause era is used to protect solely to protect the lining of the uterus from the effects of estrogen. So if you don't have a uterus, you don't need progesterone. However, it does help you sleep. So the plant-based permetrium helps you sleep. So we do have ladies who, and it makes you feel good too. So if we do have ladies who don't have uteruses and don't need to take it, who still choose to take it. But the sole reason, and it's a standard dose, people want to increase the dose, whatever, but there's one standard dose that's associated, that accompanies, excuse me, estrogen supplementation. And if it's not supplemented, then the estrogen can overstimulate the lining of the uterus and increase, not, you don't expect cancer, but increase it ultimately cause problems. So it's really important when you choose to do this to just take your progesterone. And it's, again, the permethrin does help you sleep. So it's a double extra benefit.
Yes, it does. I love progesterone.
Mm-hmm.
Yes, and I have anxiety and dealt with it for years until my late 30s when I started taking progesterone, and all of a sudden I didn't have anxiety anymore, and I was like, this is awesome. So for
Yes.
me, it just acted as a natural hormonal anti-anxiety medication. So it was great.
Yeah, I hear that a lot. So we give that to our ladies in the 30s and 40s who really don't need the testosterone yet, but they just need to sleep. And it really is amazing as you just shared.
Yeah. Yeah, it really is. It was life-changing for me.
Mhm.
Well, so pellets. I've heard a lot of different things about pellets from people. I'd like to know more about what your opinions are on pellets, and it sounds like it's a go-to for you.
That is the only way we prescribe. We administer hormones in our practice because there are a lot of practitioners who use the creams and pills, etc. Three
Uh-huh.
three reasons. The first, most importantly, first of all, they're plant-based, yam-based. The most important thing is it's all about you and your convenience, our patients and their convenience. So the pellets, you come in the office every 4 months, you get your pellets, you're good to go. So number two, we can give you less of amount of hormone to get maximum results because when we insert the pellet underneath your skin, it can go directly to the target receptors. So it doesn't have to go the circuitous route. And speaking of the circuitous route, anything you take by mouth has to be coated so the stomach acids don't destroy it. And then it goes to the liver. So the liver can change, especially estradiol, it can change estrogen to a form that's not safe, and it also can cause increased blood clotting in the legs, which could go to the lungs, increases the incidence of pulmonary embolism. So those are the three reasons why we choose the pellets, and that's after we researched everything. A lot of people use creams. Now you must remember the skin is the most difficult organ of the body to permeate. And plus it's messy and it's cumbersome because you're like, oh my God, I forgot. And I ran into the gym once recently, and a patient of mine who just decided she did pellets before and just said, I'm not going to do it again. And she went to some place and got these herbs. And then I ran into the gym, and she said, you know what, I'm going to be in soon because I forgot to take my herbs this morning. I've got to go back and take my herbs and whatever. And so it's basically it's a convenience. And we have a lot of ladies who travel who, because we're open, first Saturday of every month for ladies who commute to come in. And it's just so convenient. It's nice to not have to take something every day. And often with the testosterone cream, you might get a little patch of hair where you rub it.
Oh, okay. That makes sense.
Mm-hmm. And it just doesn't permeate. And women who come in that are using the creams or the pills, they don't quite reach our optimum desired levels that we like.
What are the optimum desired levels?
Well, first of all, when we ask someone to get labs, we ask them to just get the labs for the information and not to use their reference range. Okay. So, because functional medicine has its own reference range, but allows a patient of ours to use their insurance and get the hormone labs done. So, with the estrogen, our balancing goal is 80 to 150, 80 to 150. However, we don't strive to reach that range because we want to only give you enough estrogen to alleviate your symptoms if you're symptomatic, and then only enough to keep your bones nice and long and strong if you're not symptomatic. Okay, we do a testosterone level. Our balancing goal is 150 to 200 because a woman in a body can handle a lot more testosterone than the reference range, which I think is 20. And so 150 to 200 is the testosterone level.
Oh, okay. Yeah, that is different than what I've heard. So for
Yeah.
testosterone especially.
Well, we follow. Some people follow free testosterone. We follow a total testosterone. So there are many
Oh,
ways to
okay.
do it. Yeah. So total testosterone is a lot less. I mean, free testosterone is a lot less. Yes, a lot less.
Yes, that
Oh,
makes
yeah.
sense.
Mhm.
Okay. Okay. Let's see what else I was going to ask you.
These are great questions, by the way.
Oh, thank you. Well, you're giving me such good information that I'm just inspiring more questions. So, um, oh, so in your book you talk about how a lot of times around this time of life during perimenopause leading up to menopause, women misdiagnose themselves or they're misdiagnosed. What do you often see or uh, as a misdiagnosis?
Well, some women think are told they have chronic fatigue syndrome. Women are
Mhm.
also suggested maybe their thyroid is low, and then they get the test and says, "Well, your thyroid's normal." I think the issue is when, unless you go to a functional doctor or someone who does this regularly, they're not familiar with the hormone balancing. So the answer most women get are everything's fine, you need more rest, or it's just something I don't understand. Maybe it's chronic fatigue, Epstein. I don't think Epstein-Barr, any one of those syndromes that are just vague and without a lot of description. We
Mhm.
have a lot of patients who come to us with who've been diagnosed with chronic fatigue. When we balance them with testosterone, they're just like good as new. Many patients who are on anti-anxiety meds, which I love because I just don't like pharmaceuticals, relaxants and pharmaceuticals. So many of them who are on these pharmaceuticals are able to get off of them when we balance their testosterone. Women who are on meds for anxiety, for depression, etc. So we don't ask you to get up because some people, of course, I want to just make a comment if people are under the care of a psychiatrist and they're diagnosed with depression, except that we don't want them to stop their meds. But if women are feeling sort of sad and blue and want some medicine to help lift their spirit, often balancing their hormones is the solution.
Yes, definitely. I agree with that. Biopsychosocial, right? Let's first look at the biology and see if we can
Mhm.
get that balanced.
Correct.
Um, what was my other question I had? See, brain fog, right? Um, what are your suggestions for being able to, because I know you're in California, am I correct? You're
Correct.
in California. Okay,
Mhm.
in Los Angeles. Okay, so that's where people can find you as a provider. And so people in other states maybe that can't get to California, how would you suggest people look for a provider and what keywords, maybe functional medicine would be one. If somebody's just popped in and hearing this and like, oh, wow, I really want to find somebody who can help me with this. Is there a group of doctors that you would recommend, like a functional medicine registry or anything like that? I don't know. Where can people find providers that would be looking holistically at this?
I think people find me through Instagram or they find me by Googling bioidentical hormones. And I think most importantly, what someone would wants to understand is how long they've been doing it, because there are pellet courses that women can that doctors can take over the weekend. Not only doctors, nurse practitioners, and other allied medical personnel that they can take a weekend over the weekend. We first of all, I'm a gynecologist, so hormone balancing and the care of women has been my career, and I have credentials in it, certifiable credentials. And we've been offering this since 2008. So we've been there, done that, and handled most of the complications. So we've really fine tuned it here. So I think the most important thing is to find a board certified gynecologist, because if you have a uterus and you're taking hormones, there's a real likelihood you bleed. And I know there's one person in LA and a couple of the entities that sort of teach doctors to do this. They do not know how abnormal uterine bleeding, postmenopausal bleeding, has to be taken seriously. It needs to be evaluated. Where these entities are taught, teach people, change your progesterone, increase your progesterone, do what, all these kind of stuff. And there have been a couple of cases of women who developed uterine cancer undiagnosed because the postmenopausal bleeding was not properly identified and managed.
Oh, wow. Yeah. Okay.
So that would be my thing, is to look and see how long they've been doing it. Look at the website and get a sense of where they were trained, who they train. For instance, I can take what I'm taking, what I do with pellets, and I can put a name on it called LaFleur. Look into something LaFleur. And I decide I'm going to have conferences and teach people how to do LaFleur like it's brand new. The people
Mm-hmm.
can come and take this for a weekend and then get certified and start doing this. Okay, and there's a company called BioT that does this, and they certify and they want you to sign up in the registry. And but there's nothing like having personal experience. And I would suggest any woman who has a uterus to not let anyone balance her but a gynecologist. Without the uterus, you can follow up things, but there's just a lot of fine tuning that I know I've learned over the years. For instance, when I was trained in 2008 or whatever, the doctor trained me these high doses of estrogen. And I called him. I said, well, all my patients are bleeding. I mean, I'm a gynecologist, so great. I had uterine hysterectomies lined up, right? But patients weren't really happy. And
No.
actually, I took that dose myself, and my uterus just grew. And I had to get a hysterectomy, which was
Oh,
liberating.
wow.
I'm happy to get it. But then when I asked him again, he said, "Oh no, I never use, like he maybe taught me 50 milligrams of estrogen." He said, "No, I never use over 18." So I'm like, "Well, why would you?" And then there's the fine tuning thing. He said, "Well, whatever it is about women, it makes them more prone to have fibroids. They can be more sensitive to this." Kind of a statement, but it's way more sensitive than that. Whatever it is in women, specifically of color, that makes us more prone to have fibroids, you have to be very careful about the balancing, because we don't understand why they grow. But if you overbalance them, which means gives them too much estrogen, those fibroids may grow and cause problems. So
Oh my
there's a
gosh.
lot of information that you would know if you were a gynecologist,
Yeah.
and you had the years of experience, that you would not know if you took a weekend course. For instance, a colleague of mine heard me speak on it, so she decides to go take a weekend course, and her specialty. I won't give you a real special in case she hears this, but let's say her specialty is dermatology. Okay, just
Mm-hmm.
something. So she decides she's going to use it to balance the skin. So all of a sudden, her females started bleeding, and so she's calling me, and then she's trying to explain to me, what she's taught, and even my staff, like she has no idea what she's doing. So I told her, I had to very discreetly tell her, because I was not, you're not going to do the balancing, and then I handle your complications, and then I said, no, we're not doing it. So I just referred her to someone else so perhaps she would do that. And then I sent her a little note. I said, everybody's not a candidate. When I decide they're a candidate, I examine them, and you really don't have to examine them, but I said that you have to examine them. And she went, "Oh shit," because she's a dermatologist. She doesn't examine
Yeah.
women. She was an S, but but she was like on the thing, and I'm like, you can't just give estrogen and not have any idea of what's going on in the pelvis, et cetera, and not be able to do an ultrasound, an endometrial biopsy, and also your reputation. Because if you give someone estrogen, they bleed. Most likely, if you, especially 5 or 10 years ago, this person seeks care outside of your realm, it's going to be severely criticized because people, as one colleague said, when a doctor's not up on it, they're down on it. So if you and I during back in the day, I thought it was a bunch of crap until I started researching it. Found out like, no, there's a lot of validity to this.
Yeah.
So that's
Yeah. I mean, I didn't even realize that someone who wasn't a gynecologist or being supervised by a gynecologist would be prescribing
well,
the like prescribing pellets and things like that. Well, I mean, I know that there's like tea centers and things like that. So I guess that's what we're talking about, or some of these centers people can go to that just prescribe the hormones without having the background.
and they're even all physicians are not qualified to do this, not just
Yeah.
gynecologist, other and nurse practitioners can get certified because if you're teaching, you just want the money from the folks attending the thing.
Yeah.
The thing. And so I think that's what I would do is just to really, because this is a really important decision to make. I spend a lot of time with our ladies. We do the consultation virtually because this is a big decision. And whenever you select someone, I think the person just needs to have a sense that this person is very clear about what they do and they understand it and understand the gravity of this decision.
Yeah, that makes sense because there are, like you said, there's complications that can arise and people need to know what those are and be making
Mhm.
a what's the right word? Um, when you have all of the information, you're
Well,
making a
we need to have the right referrals and the right follow-up treatment and management of complications
yes.
instead of just getting excited about the money and putting the pellets in.
Yeah, and have oh and the patients being able to make an informed decision. That's what I was trying to say. Informed.
Exactly.
Informed decision. Yes.
And I think you can get a feel once you start the conversation of how qualified this person is.
Yeah, I mean, I've definitely gotten a feel for your qualifications. You know a lot, and I've loved to
Thank
talk to you
you.
for hours about this. Um, so, well, what is something that you recommend just in general for women um, going through this time as far as how to take care of ourselves? So, hormone balancing, of course, and then on top of that, are is there a different as our bodies change, do we need to be exercising in a different way or eating different foods?
Yeah, we encompass all of menopause wellness in our practice. And so we offer a program and we call it Celebrity Fit Weight Loss Plan using the hormone of pregnancy. But more importantly, we give a document that basically we call Celebrity Fit Weight Loss Tips. And we also give them the food program. So we encourage protein, vegetables, and fruit and really begin to really limit carbs. Because carbs, you may as well just grab the mashed potatoes or whatever and just stick it here because we just don't digest them well. And I think when they're hungry and they reach for protein instead of reaching for the granola. And another misnomer, the handful of nuts. The almonds are so full of fat. It's just too many calories. It's just so full of fat. The handful. Most women say, "Oh my God, I always just get a handful of almonds when I'm hungry." Like, not the best thing. Get a little piece of salmon or a little piece of chicken. And then we give them tips called, Celebrity Fit weight loss tips. Most importantly is lifestyle changes, such as never clean your plate. And then many of our ladies, including me, we sat down to mom and daddy and said, you better clean your plate here, ate everything
Mm-hmm.
because we worked hard for this food and people somewhere are starving, but you never clean your plate anymore. Everywhere when we're served, unless it's the French restaurant or somewhere in the French laundry or whatever, the portions are just too much. And so you should at least look at your plate and just decide to eat half or either take half of it off before you start, and then just remember how amazing it's going to taste the next day, because the portions are just too large for Americans. I also encourage women to weigh themselves once a week. I was one, being transparent. I wouldn't go to the physician because I didn't want them to weigh me. But now I weigh myself once a week. On Thursdays, I look at it like data, so I can
Mhm.
manage it. And that way, weight doesn't surprise you, any weight gain, because you're staying in tune. So there are a lot of the don't drink empty calories. So there are a lot of little twists and little adjustments we can have on our lives that can really make a difference. We also ask women in terms of working out to start lifting weights. You can do those machines. A lot of those machines are really female friendly. They used to be so overwhelming and frightening when you looked at the room with these guys with these big old weights and dropping them. But a lot of them are very female friendly. So maybe get a trainer to just take you through the gym and just show the machines to help you strengthen your arms and your legs and your core. I love Pilates.
Oh, I was just about to ask if you recommended Pilates.
Oh my God, Pilates keeps you long, lean, and tall, and it just when your core is toned, your whole body is feeling better. And I spin and do Pilates. Those are my usual, and I do my machines a little bit. First of all, yeah, and I think just to not settle for any limitation. Just get to the gym, start work out the muscles adjacent to the knees if the knees are damaged, and to get the knees back and strong so you get back in those heels. Everybody loves their boots and shoes, right? So that's it. So diet, exercise, and sleep is always underestimated. At least 8 hours of sleep a night because your body does need to rest and recover. So I think those are it. And then your self care, your walks, whatever allows you to soothe is best. So it should be something that you do for yourself, just to self soothe.
Yeah, yeah, to calm your nervous system.
Mm,
I'm big on massages for that. I love
yeah.
just having, I talk to my massage therapist and I'm like, this is not about getting in and finding my knots. I am here to soothe my nervous system. So that's what I want to do. I want to feel soothed after I leave. And if I almost fall asleep, then I know it's a really great massage.
I agree. I get one every other week.
Yeah, it's so good for your body. Such a
Mhm.
nice release of whatever energy that you're holding. Well, so Gail, as people or Dr. Gail, as people are listening and wanting to work with you, how can they find you? You mentioned Instagram. And anyway, please just tell us all the places we can look for you that are appropriate. We're not coming to your house.
Okay, yeah. I laugh because I have people who share all that, but anyhow, because code to share is my website's www.drgailjackson.com. So everything is at drgail
Okay.
at dr, not do. So Instagram, website is www. Email is info@drgailjackson.com. Phone number, nobody calls, 310-451-2300. Yes, I think email, website is the best way to reach us.
Okay,
Email.
wonderful.
Yeah.
So for everyone listening that's just struggling in perimenopause, menopause right now, what would you like them to hear?
You can feel absolutely.
You don't have to feel like wet. What did I say earlier? I don't know, like wet tissue
Cardboard, right?
paper.
Cardboard.
Cardboard. Yeah, wet
Yeah, that
cardboard.
was a good
Or
line.
even on a fragile day, wet tissue paper, I guess. So, yes, absolutely fabulous. That is reachable. It's not just like you don't have to just suffer through this. I love it.
Correct.
Thank you so
Correct.
much for your time and all of the information you shared today. It's super helpful. And
Thank
hopeful.
you so much. Yeah. Thank you so much for inviting me. This was wonderful. I love to chat. And I look forward to meeting all you ladies and listening to you. I want to hear your stories. And I think the other thing is we offer complimentary consultation. So you can get your labs, we fill out a lot of information, and we offer complimentary consultations.
Oh, that's fantastic to know. Okay,
Mhm.
that's wonderful. Well, thank you so much for your time and for offering those consultations because that's you giving your time again to provide hope to people. So I think that's wonderful.
Absolutely.